My name's Professor Steve Archibald. I am a Professor of Molecular Imaging Science at the University of Hull.
My name is Steve Giles. I'm a mortgage broker. I have an office in Swanland.
My name is Andy Fletcher. I'm a consultant haematologist here in Hull and East Yorkshire Trusts.
Unfortunately, a year or so ago I had a sore throat and a cough, and I ended up having a tonsillectomy, which turned into cancer of my tonsil and mouth and throat. So I visited on numerous occasions over the last year.
There are a lot of very challenging diagnoses to make, both diagnostically and how you investigate them with things like the scanners and the PET scans that the DAISY appeal helps us with, but also breaking the bad news to the patients and their families.
I had quite an intensive course of preparation, shall we say, for my treatment. My expectation would be that if the lump was on my arm, I could go in over the next week and have it removed. As it was, it took almost 2 months.
The scanners that the DAISY appeal provide, or help provide within the NHS, help take patients from not knowing to knowing exactly what they have, where they have it, so we can give them the best and most specific treatment for their condition. The
technology is positron emission tomography. So what you do is you use a particle accelerator, that's always quite exciting from a scientific perspective, we like those, to make some short-lived radioactive atoms. These are tags. We tag those into a molecule, we inject it into the patient at the hospital site, then that can be detected in a scanner. And what that allows your doctor to do is to work out the best way to treat the disease. And that's going to lead to the highest percentage of recovery for cancer patients.
When you're poorly and you have to travel, you are exhausted. So providing local services for patients to protect them from all the side effects of their disease or their treatments when you are assessing them or reassessing them is essential.
My friend sits on the board of the DAISY appeal. He'd told me about it numerous times over previous years. I'd completely ignored him because it doesn't affect me one bit, and then suddenly it did affect me in quite a dramatic fashion.
And positron emission tomography, or PET as we call it, is the one that really allows this highly sensitive molecular level information. And so this is really the key. Better information means better decisions and better outcomes for the patient.
Coming out the other side of my treatment, I look back on it. One, it seems like it never happened. Secondly, I know that I received the best treatment possible with the best people, with the best equipment, because of the DAISY appeal existing to assist local people in the position that they're placed in, unfortunately.
There are two great things to this. One is this new development is going in on the Castle Hill Hospital site. It's a joint development which the DAISY Appeal charity is bringing together, the University of Hull, which does research and technology development, and the NHS, which is treating patients and is very interested in the best standard of care.
I'd like to thank everybody at the DAISY Appeal, the Queen's Centre, my Macmillan nurse and all of the staff for helping myself and Vicky come through this. And this is really important, so please donate today for local people in the local area.
People should donate to the DAISY appeal because it provides excellent facilities and excellent research to improve the care of their friends, their families and potentially themselves.
When I received the news that I was in remission, I think it was the best 2 minutes of my life, really. I would say make as big a donation as possible. You never know if and when it's going to affect you or your family.